The outbreak that started with an unvaccinated driver last week has now reached all the way to New South Wales Parliament.
I was tested very early this morning and isolated and returned a negative test a couple of hours ago.
Another case has been linked to the party in West Hoxton, taking that cluster to 12. The link to Sydney's Bondi cluster was an infected Bondi Junction worker who attended the party and unwittingly spread the virus. 3 of the new cases are close contacts of a Double Bay hairdresser, but it's still not known how he got infected. It's one of 3 mystery cases now being investigated out of 49 total active cases.
There's 3 cases where we haven't got a clear link. It is the 9-year-old that we haven't got a clear link. The hairdresser from Double Bay, we haven't got a clear source there. And there is a person in a health facility that we know that there have been a patient there that attended, but we can't find the exact crossovers.
The New South Wales Premier is ruling out a lockdown for now.
Since the pandemic has started, this is perhaps the scariest period that New South Wales is going through.
The Premier and State Police still haven't concluded their investigation into how an airport driver was unvaccinated.
I'm as upset as anybody and frustrated as much as anybody. We all work so hard and it's really disappointing when things don't go the way they should.
Victoria's also recorded 2 new cases linked to the Sydney outbreak, one who attended the West Hoxton party, the other a subsequent contact. Jane Halton chaired the National Review of Hotel Quarantine, and Professor Greg Dorr is an infectious disease expert at the Kirby Institute. Greg, let me start with you. Any other state in Australia would have all of its residents locked down in this scenario. How do you assess the call that the New South Wales state government's making?
Look, I'm very confident in the decision they've made. I think they're looking at some key pieces of information. So they're looking at the number of cases that are under investigation, the number of cases that are linked, the number of cases that were detected while in home quarantine are really important. So it's not just the raw numbers that they're looking at. And even if you looked at the raw numbers, if we compare the current outbreak to the Northern Beaches outbreak, 8 days into the outbreak, Northern Beaches was about 120 and 130 cases. So we've had less cases so far because we picked up this outbreak quickly. We didn't have a period of undetected spread that they had in the Avalon RSL initial outbreak.
Jane Halton, we know that this started with an unvaccinated car driver transporting an international flight crew. The New South Wales Health Minister Brad Hazzard said on this program last week that that was an unknown unknown. Was it?
Well, it's actually quite disappointing that this has happened because, of course, we've known of the risk from people who are transporting airline staff since the very beginning of this whole pandemic. And indeed, it's something that has been discussed in the past. Now, we all understand that mistakes are made, but these sorts of things should be part of the systems and processes we have to make sure we prevent, wherever possible, this kind of spread. So, no, we've actually known about these drivers and the risks that they present to all of us.
When you say that had previously been discussed, the idea of the risk of unvaccinated drivers and transport crews, where was it discussed? Who was it discussed with?
So whilst in my review that wasn't a focus, certainly it is something that I talked to a number of people about, making sure that there was no possibility that this virus could come in and spread from one of these workers. So everything from how these people were going to be transported to their accommodation, and indeed, as we've already discussed, the protections that people would actually have for the workers doing that transportation. So this has been discussed, and it was discussed probably 6-8 months ago.
Is it fair enough for the public to throw their hands in the air and go, well, when are these basics going to be taken care of? Because the situation also in Victoria was a lack of government oversight of a key part of the process, as was the case with this car driver.
Look, I think that's a fair enough observation, Lee. The truth is what we need is for these systems to be literally end-to-end secure. And that means thinking about every single element of it. It means ensuring that, for example, if you get somebody new who's going to be a driver, that you do that with enough care and thought about their training, the fact that they need to wear masks, and vaccination, because we now know that vaccination is really important to give everybody some sort of protection.
Professor Dorr, how do you think that success is going to be measured in terms of this incident in New South Wales? Is it a return to zero COVID? Is it avoiding a wholesale lockdown? Is it fewer deaths than would occur in any single week than, say, heart disease in New South Wales? How will success be measured at the end of this?
I think the strategy will remain that we need to get back to zero community transmission. And the reason for that is that we still don't have sufficient broad population vaccine uptake to rely on that to give us even decent disease immunity. And I think that's got to be the first sort of target, disease immunity. So until we get to much higher vaccine uptake levels, we'll remain, I think, in sort of an elimination strategy type mode.
Jane Halton and Greg Dorr, thank you very much. Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.